Good evening. Good evening. Ah, son.
Can you hear me?
Yeah, yes.
Okay, thank you very much.
Good
okay,
evening.
So thank you very much. It's a great honor for me to participate to the 6th edition of FORSCA Congress, and thank you to the Broxy Group and Dr. Maurizio Gialli for inviting me in this very important Congress.
You're welcome.
Thank you very much. My presentation, it will be a pleasure for me to share with you my experience in regenerative therapy. Now I'm sharing you my slides, and so I can start my presentation. Okay.
Okay.
Let me, okay. That's it. Perfect. Can you see the slides?
Yes, yes.
Perfect. Very well. Very well. Okay. As I told you, my presentation, the topic of my presentation is the regenerative autologous therapy. The concept of this devices that I'm going to present to you is the power of simplicity. The mission of these devices is to take the autologous regenerative therapy easy, safe, and effective. When we talk about the autologous regenerative therapy, we are talking about the autologous homologous microfragmented adipose tissue graft, and it leverages the power of the stromal vascular fraction and mesenchymal stem cells to repair and regenerate the tissue. This kind of therapy finds indication in many fields, in medical fields, as we are going to show you. When we talk about the autologous regenerative therapy, we don't talk about merely a fat graft, but for me it's extremely important that our concept is a tissue graft. The reason why, when you harvest the cluster of adipose tissue, of course you are harvesting adipocytes as well, but for us, the most important part of this tissue is the stromal vascular fraction, and in the stromal vascular fraction, in particular, the growth factor and the adipose-derived stem cells that have the capacity to transform in the adult lineage of mesenchymal tissue. Another very important concept in the autologous regenerative therapy is disease is a therapy, and so it is dose dependent. And for this reason, it's extremely important to know how many cells we are going to administrate to our patient when we perform the regenerative therapy. And so we know that in 1 ml of adipose tissue, you have an average of 200,000 to 3 million cells of the stromal vascular fraction, and 1 to 10% of this population, cells population, are mesenchymal stem cells. The action of the mesenchymal stem cells and the stromal vascular fraction, of course, the capacity, as I told you before, the capacity to transform in the adult lineage of the tissue. And so mesenchymal tissue has adipose tissue, chondrous tissue, osteocytes, but also in the population, the stromal vascular fraction, there are as well the fibroblasts that have the capacity to produce collagen and glycosaminoglycan. There is a great amount of growth factor. For example, the vascular endothelial growth factor that increase and enhance the vascularization of the tissue, the capacity of homing, the antifibrotic activity, and the immunomodulating activity. The main concept in all the devices that I'm going to present to you today is the CEFI concept. The CEFI procedure, I published this technique in 2015 and in the Aesthetic Surgical Journal. And this procedure focus the attention in the harvesting part of the procedure. The reason why, when you harvest the tissue with a big cannula with a small side port soul like this, like in the other technique, you are harvesting very big tissue cluster, and so you need a lot of manipulation of tissue in order to reduce the dimensional cluster, in order to fluidify the tissue, to allow to inject the tissue in the superficial layer. In the CEFI concept, we are harvesting this tissue with a super small cannula with very small size port soul, and so we are harvesting the small cluster of tissue, and so the tissue is already fluid, and it doesn't need any kind of manipulation. As I told you, if you harvest the tissue with a big cannula, with a big side port soul, of course you need a lot of manipulation. And so on the market, there is a great amount of medical devices meant to reduce the cluster. Remember, this kind of devices that filter, grinder, or squeeze the tissue don't separate the stem cells, but only reduce the dimension of cluster. It's only cluster reducers, are not the selecting the cells. And so this is very important. And I will prove with my study that any kind of manipulation reduce the cell viability and reduce the capacity of these cells to growth. And so when you use the CEFI technique, you harvest the tissue with small cannulas, small side port soles, and so you harvesting very small tissue cluster. This cluster doesn't need any manipulation before to be injected. Of course, we publish a great amount of studies, and we publish in the most important journal, scientific journal all over the world. And in this paper, in this study, we prove, of course, the viability of the adipocytes, but most important for us is the capacity of these cells, of the stromal vascular fraction cells, to grow, and so the growth rate of these cells, and the capacity of these cells to create colonies. The colonies is the first step to transform the tissue in the mesenchymal lineage of this tissue. And so in the last year, 2 years ago, sorry, we published this paper, and we proved that with this technique, we are harvesting the stromal vascular fraction. In the stromal vascular fraction, you find the pericytes. The pericytes are tiny cells attached to the vessels in the tissue, in the adipose tissue, and these pericytes transform in mesenchymal-derived stem cells, and then from the mesenchymal-derived stem cells transform in the tissue of mesenchymal lineages. And so this is our last study that we proved, as I told you before, that without manipulation, we are an increase in viability of cells, but more and more you have the increase the growth rate of these cells. You can see in the upper side of the slides, you can see that this chart is the CEFI line devices. You can see that without any manipulation of tissue, at T0, you have the viability, the cell viability is 250,000. With other device that manipulate a lot of tissue, in T0, you have only 15,000 cells. But for me, the most important thing is that after 72 hours, without any kind of manipulation, and so respecting the tissue, the cells from 250,000 are 3 million. With the other device, after 72 hours, you decrease the cells and you have 14,000 viable cells. This study proved that the manipulation interfered very bad in the cell viability and in the growth rate and the growth rate of the tissue. Sorry. when I published the CEFI technique in 2015, this was, of course, a surgical technique, a minimal invasive but surgical technique. In 2020, I published the Ceph-filler and Ceph-line procedure because this is a medical procedure. How I can transform a surgical procedure in a medical procedure? This is possible thanks to this guide, because in my idea is that the regenerative therapy must be performed also by colleagues without any surgical skill, without any liposuction skill, and in their facility. And so thanks to this patented guide, we can perform this procedure by doctor without any surgical skill and without liposuction skill in their facility in a standardized, easy, effective, and safe way. Now I'm explaining why. When you insert the cannula and the syringe inside this patented guide, as you can see in this picture, the cannula protrudes 15 millimeters from the edge of the guide, and the cannula is 15 millimeters far from the blade of the guide. And so when you penetrate in the skin, is enough the cannula is extremely thin, and so it's enough to perforate the skin with a needle. And so you insert the cannula under the skin. The guide allows the doctor to introduce the cannula only 15 millimeters, and so it prevents any risk to insert the cannula too deeply. Moreover, when you turn the guide and you insert the cannula under the skin, you are sure that your cannula is moving under the skin in the depth of 15 millimeters. And of course, it grants to order the tissue not only in a correct plane and a very safe plane, but for me, another important thing, and that you are investing the tissue where you can find the greatest amount of stromal vascular fraction. Several studies proved that the tissue, the superficial adipose tissue, the set tissue, is richer in stromal vascular fraction cells. And so this patented guide allows the doctor without any surgical skill or liposuction skill to harvest the tissue in very safe, easy, and effective way. The other important characteristic of the Ceph-line devices is that, first of all, is all-in-one. All the material that you need from the harvesting procedure to the injecting procedure are inside the devices. Inside the devices, you find, of course, the guide, the cannula, the Vaclox syringe, the special cannula, the special harvesting cannula, but also you can find the drape, the bolt, the caps, anything you need to perform all the procedure in your medical facility. The Ceph-line developed 4 medical devices meant for the regenerative autologous therapy in different medical fields. We have a Ceph-filler. Ceph-filler is the device for, as you can see here, you can have Ceph-filler is for aesthetic medicine, and so for regenerative therapy, mostly for the face, but it's possible also for the hand, for the neck, for the décolleté, but also the Ceph-air for the trichology, for the autologous regenerative therapy in androgenic alopecia. The Ceph-gene is for gynecology, and so for the genitourinary syndrome, or for the enhancement in the quality of the tissue of the female genital. And the Ceph-care is for orthopedics, for wounds care, and for vascular surgeon, for any other fields that is possible to use the regenerative therapy. Now, I'm showing you this short video just to explain you the procedure. Okay, first of all, I stop the video because I wish to underline this concept. All the material that you can see in this video is inside the device. For example, the drape with the round hole to put around the harvesting area is inside the medical device. The syringe, the needle, all the gauzes, all the material that you need is inside the medical device. The only thing that you need is only the sterile gauze and the anesthetic solution. Well, you perform a little bit of anesthetic solution in the entry point. After that, with the needle that are inside the device, you make a small hole in the skin. It's enough, a smaller hole with the needle. We don't need stitches. After that, only a sterile strip. Then you use the same system that you are going to harvest the tissue. I stop the video again. Sorry, I go back. Okay. Okay. I'm telling you that you use the same system, the same syringe, the same cannula, the same guide to inject the anesthetic solution. This is very important. So we are sure that they are injecting the anesthetic solution in the same plane we are going to harvest. Then you penetrate with the cannula, you go under the skin, you maintain touching the blade of the cannula to the skin, and so it's extremely easy, extremely safe, and extremely effective, the procedure. You are injecting the anesthetic solution. It's enough for 20, 30 ml of anesthetic solution. You don't need any tumescent technique. You need only 20, 30 ml of anesthetic solution. You wait 10 minutes. After that, you reconnect the cannula to the syringe, insert in the guide, and then you lock the syringe to the guide, penetrate in the skin, rotate, and go under the skin. Very easy, very safe. You don't need any surgical skill. You can perform this procedure in your medical facility. Pull the plunger lock, rotate clockwise, the plunger is locked, and now you have only to move back and forth to have the tissue that is going inside the syringe. You can appreciate the tissue is going inside the syringe, super fluid, because we are investing the tissue in a very small cluster, and so you have the tissue that is already very fluid, and so you don't need any manipulation. After that, you transfer the tissue in another syringe that are inside the medical device, is the reservoir syringe. You transfer the tissue in the reservoir syringe through a syringe transfer without any filter, without nothing. After that, you fill it up, the reservoir syringe, with saline solution, just to wash out the anesthetic. Cap the syringe and put the syringe in the syringe holder. And so you wait for decantation of the tissue. In the meantime, you harvest a second syringe if you need more tissue. And so again, you insert inside the guide, you penetrate through the hole, you lock the syringe, you penetrate from the hole, you rotate the guide, and you go under the skin. Pull the plunger, rotate clockwise, the plunger is locked, and now you can start the procedure. Super easy, super safe, super effective. You don't need any skill, because the guide allows you to harvest the tissue in safe, easy, and effective way. Again, you transfer the tissue in the reservoir syringe, and after that, you fill up the syringe with saline solution. You know the lidocaine has a little bit interfere in the cell viability, and so I prefer to wash out in the tissue. But as you can see, I treat the tissue in very delicate way. And so after a few seconds, you can see the separation of tissue from the washing liquid. And so now you go to discharge the washing liquid and maintain in the syringe only the tissue. You can see I'm discharging the washing liquid. And so you can transfer, you discharge all the...
Something went wrong. Please try again.
You discharge the liquid, the washing liquid, perfect. You cap the syringe again. And now you have your tissue, the third syringe. You do the same procedure, discharge the liquid. You have the tissue in your syringe. After that, I prefer to transfer the tissue only one syringe, and then I transfer the tissue in a smaller syringe, as you can see, because it's easier to inject with a smaller syringe. I repeat and I focus the concept. All the material that you can see in this video is inside the medical device. So very easy, very safe, very effective. And now I'm going to present you the treatment of the filler for medical purposes, and so to regenerate, for example, the face, to regenerate the tissue. You have different kind of fluidity. You can change the fluidity. Of course, we will organize some specific course for the different devices. And so the plane where we are injecting the tissue. And so anyway, the most important thing, you can use this tissue as it's very important to inject the tissue very superficial. This one is not a lipofilling. This is the regenerative therapy. You are sewing the cells. You are creating a carpet of cells under the skin. Is a regenerative therapy. This one to enhance the quality, the tone, the volume, the quality of the skin. This is the only real anti-aging therapy for your patient. You can treat all the face, of course, you can treat the lip, you can treat the marrow and zygomatic, as I told you. And the important thing, the result is extremely natural because you are using the tissue of your patient. Is safe and natural. This is very important. Is a real anti-aging treatment. The result is safe. The procedure is safe, and the result is supernatural because the face maintains the mobility, maintains the softness of the natural tissue. It's not like a filler that fills the face and creates some kind of unnatural result. This is a tissue. The most important thing is to inject very superficial. You don't need to overcorrect. You inject just the cells that you need just to enhance the quality of the skin. This is the concept. You can treat all the area of the face. It's extremely safe because this is a patient tissue, and so you can have any kind of reaction. The result that you will achieve is extremely natural and is something that can cure the quality of the skin of the patient. Now I go a little bit faster. You can treat, of course, the barcode. You can see, for example, now I show you another area. For example, the area of the jaw, the marionette line. I use the chin entry point, and I inject the tissue very superficial. You can see the key of regenerative therapy is to inject the tissue very superficial. It's like a carpet of cell. The concept is sewing cells under the skin. Of course, you can treat the temporal area as well. It's very important. Sometimes in the aging of the face, you have the decrease in the volume of the temporal area. And so you can treat also the temporal area. But of course, you can treat also, this is a temporal area, you can treat also the periocular area. Now I'm injecting the anesthetic solution, and after that, I'm injecting the tissue. It's extremely important for the enhancement of the beauty of the eye, the beauty of the glance. Is more important to recreate the volume. You can see here, this is the needle. After that, the hole, the guide needle. After that, I insert the microcannula and I inject my tissue under the orbicularis muscle. Is very important to create the volume and regenerate the skin and the muscle in periocular area. I'm a plastic surgeon, but in the last years, I decreased a lot my blepharoplasty, my surgical blepharoplasty, and I increased the regenerative of the periocular area. In the majority of our patients, is more important to recreate volume, to regenerate the skin, than to cut the skin and to harvest the tissue around the eye. Remember, it's a regenerative therapy. Okay, you can see here, before, after 6 months of treatment, you can see the enhancement in the quality, in the tone of the skin. Again, after 3 years, the patient is 3 years younger than this patient. You can see it's a terrific increase in the quality of the skin, in the volume, in the tone. This is again 3 years after treatment, before, after 3 years. Again, after 13 years, after 8 years, This girl is 13 younger than this one. You can see after 13 years of regenerative therapy, the face, the tone, the quality of the skin is better than the 13 years before. Now, I introduce you the technique for orthopedic treatment. In this case, of course, you treat the joint, for example, of the knee joint, of the hip joint, for the degeneration of the cartilage. This is a very good treatment to prevent the surgery, and so you can perform the procedure in the same way as I present you before. In this case, I'm harvesting the tissue, the orthopedic is harvesting the tissue in the belly area. You already see, very easy, very safe, very effective. You can harvest the tissue here. After that, you wash out the anesthetic solution, okay, decantation of the tissue. After the decantation, you discharge the washing liquid. After discharging the washing liquid, you have the tissue ready to inject. You don't need any manipulation, and you can inject in the joint. This is very easy, very safe, very effective. No manipulation, and maximum cell viability, and the best growth rate of the cells. Very easy, very safe, very fast. Again, the safe care for the wound care. I'm presenting you a case of necrotic skin lesion of the abdomen. It's very bad lesion after abdominoplasty in a smoker patient. And so you can see this one is a very bad wound. You can see here. And so we perform the regenerative therapy. In this case, I'm harvesting the tissue in the trochanteric area. You can harvest the tissue wherever you have a little bit of fat depot, the belly, the trochanteric, the hip, wherever you want, wherever there is a little bit of adipose tissue. The harvesting procedure is all the same, very easy, very safe, very fast. After that, after harvesting a small amount of tissue is reaching stromal vascular fraction. Then, as before, you wash out the lidocaine. For decantation, there is a separation of tissue and washing liquid. You can see here. And after that, you can inject all the border of the wound. You can inject the bottom of the wound. And then I'm injecting all around, and you can see I'm injecting all around. It's extremely effective, this treatment. You know, it's reaching stromal vascular fraction, reaching fibroblast, reaching growth factor, endothelial growth factor, have an antiseptic activity, and so increase the healing of the wound very, very, very fast. The healing is super fast, and you create a great boost in the healing of this very bad wound. And so after the injection, the medication, you can see I put a gauze over, and then you can see this is before the treatment. After I can see here, after 20 days, you can see the boost in healing. Okay, I go faster. Okay, this is a treatment in gynecology. The concept is exactly the same for genitourinary syndrome. This is the device. I go a little bit faster. You can see that the harvesting procedure in trochanteric area, but now the preparation is the same, and now the injection of the stem cells for genitourinary syndrome. We present, this is the pattern of injection of the stem cells. We published in the International Journal of Gynecology and Obstetrics our study of 15 women with GSM syndrome, and after 6 months, you have the main problem of this concept disappear. Is extremely effective. You can see the effect of the regenerative therapy, and is extremely effective. In Lichen 2, we have some cases. Last but not least, we have the treatment for the alopecia. You can here harvesting the tissue in the trochanteric area, preparation of the tissue, the same thing. Only for the For the treatment of the hair, we used to centrifuge the tissue just to use only the liquid part. And then we use carboxytherapy before the injection. We are vesting only the liquid part of the tissue just to perform the injection. And then we use a multi-injector, very easy, very safe, and very painless. Again, this is our work. We publish the work that after centrifugation, the stromal vascular fraction cells go in the move in the infranatant part, in the lipid part, and then we publish this very nice result in cicatricial alopecia, some result very fast, and then remember, the autologous regenerative therapy is a medical procedure, is an anti-aging procedure, is a regenerative procedure, and so it's more important to say to your patient that you have to perform the procedure every 6 months, every 1 year, but you have to repeat the treatment. It's not a liposuction, it's not PRP. You can combine with PRP, but it's not PRP. The PRP is only growth factor. When you perform the autologous regenerative therapy, you inject growth factor and stem cells. And so in conclusion, we can see that this procedure is safe, thanks to the patented guide, is super easy, have 4 different disposable, only one devices, and is effective. You don't need any kind of manipulation. And the guide permits you to allow you to harvest the tissue in the superficial layer where you have the bigger amount of stromal vascular fraction and mesenchymal stem cells. Thank you for your attention.
Okay, thank you, Professor Gennai, for this excellent exhibition.
Thank you very much. Thank you to you.
Any question? Any question? Question? Est-ce que vous avez des questions? Allez-y, monsieur. Micro. Micro. Il doit... Oui.
S'il vous plaît, les atrophies vaginales, les causes, les étiologies, all atrophy vaginal for women menopause or all problem for atrophy vaginal. And if you endodicize atrophy vaginal after injection, you don't have any problem? Do you understand my question or no? Can I repeat you?
Okay, yeah. Okay, I can understand your question, and we can use the CEPI gene for regenerative therapy, not only for vaginal mucosa atrophy, but also for the symptoms in, for example, in genitourinary syndrome. For example, the burning, the itching, the dryness, the pain and penetration, and all this kind of symptoms decrease very fast after 1 month and lasting for at least 6 months, 1 year. And so I think that now we can see that the regenerative therapy is one of the most promising treatment for the genitourinary syndrome in menopause. Of course, you can combine the carboxytherapy. You can combine, if you want, PRP2, the PRP. You can combine the PRP. You increase the growth factor. But anyway, the regenerative therapy, I think that at the moment is one of the most promising therapy to treat all the symptoms of the genitourinary syndrome.
Thank you.
Pleasure.
Yes.
S'il vous plaît, question, docteur Gillon.
Bonsoir. Moi, je voudrais poser une question à propos. Pourquoi le prélèvement dans la région abdominale périombilicale? Ça, c'est ma première question. Ma deuxième question, c'est comment peut-on comparer les résultats de la thérapie cellulaire comparée à la thérapie par le plasma riche en fibrine? Et je précise bien le plasma riche en fibrine. C'est pas le plasma riche en plaquettes. Merci.
Okay, I think that I can understand French. I'm not sure, but anyway, I think that the first question is about the harvesting area. The harvesting area you can harvest in the belly, around the umbilicus, or in the trochanteric area, or in the hip, wherever you have a fat depot. The important thing is not so important the area, but is the most important the level of the harvesting of the tissue. And so I mean that when you harvest the tissue, you can harvest wherever you want your adipose tissue. The most important thing is to harvest very superficial. And thanks to this guide, you are going to harvest the tissue only in the superficial layer, the superficial adipose tissue. This is the most important thing. After that, you can harvest wherever the patient have a little bit of adipose tissue. The second question, if I got well, I think that the difference between the autologous regenerative therapy and the PRP. I had the slides, of course, the time is running, and so I cannot explain very well these slides. But now I have the opportunity to focus this concept. The PRP is a very good treatment. It's a treatment with this leverages the growth factor that you can find in the platelet. But there isn't any kind of mesenchymal stem cells or stromal vascular fraction cells in the PRP. And so when you perform the PRP treatment, you are performing you are fertilizing your tissue. You are putting some growth factor in your tissue. When you perform the regenerative therapy in the tissue, you find the growth factor, but also you have the cells of the stromal vascular fraction. And so I said that when you perform the regenerative therapy, you are fertilizing and sewing the tissue. And so you put you put also cells, not only the growth factor. Of course, as I told you, you can combine the two techniques. The best ratio is 20% of PRP and 80% of the regenerative therapy. But remember, when you perform the PRP, you are performing a regenerative therapy through the growth factor, but you don't have any stromal vascular fraction cells. When you perform the regenerative therapy, you perform both stromal vascular fraction and growth factor.
Autre question? Non? Thank you, Professor Gennai. I hope to see you soon in Morocco, especially in this Congress, fourth Congress. Thank you. Thank you.
I will. Thank you very much for the kind invitation, and thank you again.